In. Hiya.
Hi, James. How are you?
I'm all right, thank you. How are you?
Very well.
Yeah. So, thank you very much for joining me. Like, I'm really excited for this one tonight because I've got questions and people have messaged me questions, and we're all very interested in sort of what's going on because there's so much misinformation and nobody really seems to know what's going on. You know, all of a sudden everyone's an expert in epidemiology. So, what I would like, the first thing I always get people to do is introduce themselves and tell us sort of who they are and why they're here, and just tell us a little bit about you. So please tell us your name, tell us what you do, and tell us all about you.
Sure, it's great to be here. I've also had lots of questions and interest about today, so hopefully lots of people will be joining. I'm
Yeah.
Kotha. I'm a public health doctor and epidemiologist. So I started off as a regular doctor seeing patients in hospital with heart attacks and angina, asthma, all of these things that we see after some of these after poor lifestyles. And after several years of this, I realized I wanted to go into prevention. So then I also trained in public health. And then I did a PhD in epidemiology, which means I could both understand, conduct, and interpret the science. And so most of my work, it's lovely to see some of my friends joining as well. Most of my work is on chronic disease and prevention. So diet, physical activity, tobacco, alcohol, how you live a healthier life, how you set up health systems actually to deal with chronic disease. But
Yeah.
what we're seeing now, possibly for the first time, is that our lifestyles actually impact our risk from infectious diseases like COVID.
Okay.
And we haven't really seen that on this scale, at least in our lifetimes. And so I've become involved also in COVID, and it's really impacted on all of my work.
Of course.
And I'm looking at how your diet and exercise and lifestyle really can impact your risk of COVID. And I really, I really think of this as a kind of long-term game, because after this, God knows if there's another pandemic of some other disease. And I think all of us need to recognize that not just because we can't see that our blood pressure might be a bit higher, our cholesterol a little bit high, it doesn't mean that we're safe and immune from diseases that will come along. And typically, I think most people think, oh, you'll get heart disease when you're 60, 70, 80. But actually, no, we're seeing now that if you have a poor lifestyle now, it can impact whether you get disease in your 30s and 40s and 50s.
So
But I'd like to also hear how it's impacted you.
yeah, so I refer to this. So we talk about, and there's loads of points there that we're going to talk about for sure. But there's the first point I'll talk about is how the lifestyle now affects your lifestyle and your sort of fulfillment when you're old. So I refer to these as dailies, DALY, which is disability affected life years, right? So if you live a certain way in your 20s, 30s, and 40s, by the time you get into your 50s and 60s and 70s, your fulfillment and your satisfaction is going to be much reduced. And I learned that through Dr. Michael Sagner and his book on lifestyle medicine, which covers exactly that. So the way that you treat yourself now is going to dictate how you live your life when you become, you know, a member of the elderly
Absolutely.
community.
Absolutely. And it's only recently that we've realized that it starts actually in utero. When you're in your mother's womb, that's when your dietary habits start forming, and that can affect, even from as early as that, it can affect your weight, your likelihood of getting diabetes, etc., later on in adult life.
Yeah, of course, not just the genetic change there, but the element of sort of learned behaviour and conditioned behaviour towards food. So if you're fed by your mother who can only cook, who will only chooses to cook fish fingers and pizza, then that's going to obviously impact on you, because obviously your dietary needs aren't going to be met, and therefore that's going to become a learned behaviour. You're going to be in your teenage, in your 20s, and your 30s doing what you were taught as a child, and actually then have to consciously unlearn that information.
Yeah, it's tricky because we do it's easy to blame parents, and it's easy to blame ourselves even. But there's a lot of evidence now that unless the environment is conducive to healthy diets and physical activity, it's too much to ask the individual to overcome all of what's around them to be healthy. And yes, we can be healthy. I think you're a very good role model in terms of staying very healthy and promoting health. But it's hard to do that, and it's not the norm. And I'd like to see it become the norm that healthy foods are the normal thing that you pick up in Starbucks or in the supermarket, that actually it's normal to cycle to work and to school, and that there's no risk of being run over. So I'd really like to see COVID as a trigger for government to help people to get healthier.
Okay, so that leads us really nicely onto this. So this is sort of one of the main questions that came up a lot, and something that I've certainly discussed in post, which is actually, so if we now are learning, and what I'd like you to do is put the science first onto this bit, which is we're now learning and understanding that actually our health and our fitness is probably the best weapon we've got against COVID. Does that mean now that this lockdown has highlighted this need as a country to address our health and fitness? Because that's one of the big problems in the UK, is that actually we've got really bad numbers when it comes to health and fitness, especially when you compare that to the rest of Europe.
Oh, absolutely. And that's why one of the reasons why our numbers and death rates were higher than other parts of Europe. We have higher obesity rates here than the rest of Europe. So, yeah, absolutely. If we look at people who were hospitalized or sadly died from COVID under the age of 50, so the vast majority of people who died from COVID were elderly or had serious medical problems. The average age, the median age in the UK was 82. And so very few people under the age of 50 did die from COVID. But those who did, 2/3 of them were obese.
Yeah.
And a fair proportion, 1 in 8, were morbidly obese, which is a BMI of 40 or more. So it was a very significant factor in young people who were getting very sick from COVID.
Yeah, no, and it is like a really fascinating point. So we've identified that obesity links to a poor immune system, but it's not just weight or an underlying issue. Like that links all to stress. It links to cardiovascular fitness. Your VO2 max. It links to the blood pressure. It links to cholesterol. Like there's a lot of links that are going to damage your immune system, which is then making you far more susceptible to an adverse reaction to a COVID-19 infection.
Yeah, absolutely. And I think quite rightly, I mean, COVID is a dangerous condition for specific people in the population. But I think generally there's a lot of fear around COVID, a lot of misinformation on social media, more so than I think ever before for a health topic. And one of the reasons I know we've been talking for a while about doing a live, but it's really good timing, I think. So I've had a lot of questions about the vaccine.
Yeah.
And so I think it was quite timely to look at that today.
Yeah, definitely. I think like the release of the vaccine, I think for two reasons why it was important. I think it was important to strike while the iron's hot, because it's a hot topic at the moment. And there's definitely questions that people have got about the vaccine. And I don't really want to focus on the conspiracy theories, mainly because they don't really make much sense to me. You know, people saying that, oh, they're only giving us the vaccine so Bill Gates can track what we're doing. People say that as they're holding their iPhone 6 inches from their face. Like, you've got an iPhone, mate. He doesn't need to do that. And that's not how these things work. But before we go, and we're not really going to go into it because it's almost nonsensical. But I've got sort of a couple of questions that I want to ask. So from your perspective as a doctor with a PhD in epidemiology, what is the best course forward now for the British public?
So I'd really like, are you asking at the government level or
No. So government level is not an uncontrollable factor. Like, I talk about spheres of control all the time, and that's outside of, like, I can't decide what Boris Johnson's going to do. But as an individual, what can we do as an individual, general public, to sort of help now with the COVID-19 situation?
Yeah, so I like to look at this in the same way we've managed all other infections in the past. Those who are vulnerable and susceptible, we now know, hindsight is a great thing, we now know who is susceptible and vulnerable, and those people should continue to protect themselves and be shielded. and the rest of us should not be putting them at any additional risk.
Okay.
So with Christmas coming up, I think we need to be very careful with people who we know are vulnerable. And we also know now how COVID is being transmitted. So the vast majority of transmissions are indoors over a long period of time, so for several hours. So spending time indoors with people for several hours, on several occasions, is by far the most commonest route. So trying to avoid that type of situation with people who we know are at risk. So that's the prevention side. All of the other prevention measures, yes, social distancing, masks, etc. We're still finding out how effective they are. So we should follow the guidelines, but bearing in mind that there's less evidence for that compared with, say, testing people early and isolating those who are positive. So that's where all of us can be sensible and can make a difference. So clearly, if you have any symptoms of coronavirus, you should get tested early, and the test and trace staff will help you identify who you have been in touch with and could have developed coronavirus from, but also who you yourself may have infected going forward. So I think being sensible about that. When we talk about isolation, that's really one of the key measures we've got, key tools that we've got for this dangerous disease. But only about 13% of people actually isolate. So once you know that you should be isolating, very few people do. And again, not putting blame on individuals, it's actually it's a big ask to ask people to stay inside for 2 weeks without any support. And so the government really needs to provide a lot more support, be it financial, childcare, whatever other support people need to help people to isolate.
Yeah. So obviously, a lot of what I do, and I do mental resilience training. I've now started working full time with a uniform service, and individuals there were saying, I got told I had to isolate for 2 weeks. So I went from being like busy every day and having a really exciting job, really vocational job, to I then had to just sit like in my room for like 2 weeks on my own, and it was just the worst experience of my life. And you think, oh, it's effectively like being incarcerated, and like very, very difficult for people to manage that.
Yeah, and I'm glad you mentioned mental health as well, or mental resilience, because I think, again, people are suffering from isolation, loneliness, mingled with fear, this kind of low-level anxiety that people have around not knowing what's down the line, not knowing what is around the corner.
Yeah.
And has taken its toll. Actually I know you've written a lot on mental resilience. I did a post on mental health, looking after mental health during lockdown. It's very important. And I think the last couple of weeks, people have been a bit more optimistic because of the vaccine, I guess because Christmas is around the corner. But I really think this is a long game, and we need to think for ourselves about our strategies. How will we keep ourselves motivated and keep ourselves positive through this? Yeah. And where are our social support network that can help us? And that's really key to getting through this. So one of my friends set up a community support group on WhatsApp. And initially it was at the beginning of the first lockdown, in case people needed help with grocery shopping, childcare, etc. This is in Oxford. It's a fantastic idea. There are well over 100 families, households now on this WhatsApp group. And actually what they have ended up doing is supporting the local independent shops in Oxford all through lockdown. And it's been, I would say, a kind of game changer in terms of supporting the local community, be it retailers, be it individuals. And so I would encourage people to look at more social support setups like that.
Yeah, I think that, when we're looking for sort of silver linings of the whole thing, I think that coming out of it and coming through the other end, I think the things that people are going to change are hopefully lifestyle. So lifestyle to improve health, like lifestyle medicine, that people are going to exercise more, get outside more. You know, when people's only opportunity to get out of the house was either to go shopping or for exercise, actually, like, some people were forced to then go out, and people were forced to go out for walks, and people were forced to go outside. So that was really, really interesting to see. Then hopefully that's going to pick up and change. And sort of the importance of gyms. Now we're seeing this 3-tier system that's been introduced. What we're identifying is the fact that actually gyms are open in all 3 tiers, because gyms are no longer classed as leisure, they're now classed as healthcare. So for me, that seems like a really positive step forward. And I know that Nick Capo's done a huge amount there, which is like great to see. But I also think that actually the promotion of small businesses and a little bit more of that sort of social care as a community, like as a community looking out for each other, like who are the people, the small business owners, and how can we, support them? How can we help them? Now more than ever is an important time when we're coming up for Christmas, talking about supporting the high street and the big chains, like your Primark. I think ASOS did a sale where they were selling clothes for like 50p. You think if they're making clothes for 50p, how much are they paying the people in Bangladesh to make them? And what so much custom is going to be taken from small businesses and are being, like, your friends who are trying to make a living is being given to these big corporations. So maybe something that's brilliant that could have fallen out of COVID is the support of local business and the support of each other.
Yeah, I hope so. I think that's easier to do in a place like Oxford and harder, say, in London, where I think the independent retailers had been driven out a long time ago.
Yeah.
But I do hope there is a reset as a result. So coming on to what else we can do moving forward, now the vaccine will become available. I would like to talk a little bit about the vaccine, because again, I've had a lot of questions. There seems to be a lot of fear around the vaccine, so I think it's worth talking a little bit.
Yeah, absolutely. I think the fear comes from there's a documentary on Netflix at the moment, and it's about there was something that was given to pregnant women. I think it was to help them with morning sickness, and basically it made the children sort of thalidomide, with born without legs and arms, as you know, and that's a very popular. It's like trending on Netflix at the moment. It's in the top 10, which means millions of people are watching it. And I think the concern is this vaccine. People say that it's been rushed, or it appears to have been rushed. Now, I don't know how long it takes to make a vaccine. Like, that's not my job. But people say it appears to be rushed, and because of that, they'd be unwilling to take it because of the potential adverse side effects. Add to the fact that on the news today, and again, I don't know how true it is, and I'm glad you're here to clarify this, it says that, the vaccine company, you couldn't sue them or you couldn't take legal action if you did have adverse effects. So all of a sudden people are saying, well, I don't want to take this vaccine if I don't know that it's safe and I don't know that it's going to have a positive effect on my physical health.
Yeah, it's very unfortunate, and that this thalidomide story has come out now. There is absolutely no similarity, no link whatsoever between the issue of thalidomide and vaccines. So the UK government, I don't know if people saw the briefing or tuned in this morning. There was a Q&A session with Professor John Van Tam, which was very good, this morning on Radio 5. And there was a briefing yesterday about the vaccine with some of the agencies in the UK who are responsible for the safety, for the vaccine task force in the UK. So the UK have bought into 2 vaccines, the Pfizer vaccine and the Oxford one, and then 5 others for 2021. So let's talk a bit about the Pfizer and the Oxford one. So the Oxford vaccine, I know the most about. I live in Oxford. I do some research here. So the Oxford vaccine it's made from a chimpanzee adenovirus, which is a different type of virus, and that is used as a vehicle for the vaccine. Now, that is not new. They have been using that since 2014. So it's been fully tested since 2014, and they've used the same vehicle. It's called a vector. They've used that same vector vaccine for several other coronaviruses and other viruses, including Ebola, MERS, flu, Zika. And so for the last 6 years, it's been fully tested. Now it's deactivated, so there's absolutely no risk that a human would catch that virus. So the active parts are removed. And what they have done for COVID is to identify the genetic code for the spike protein. If you see the cartoon of the virus that you see everywhere and the little spikes that come off it, the genetic code for the spike protein is the differentiating part for the COVID vaccine. When that is injected, the body thinks that you have the COVID infection, and so it produces B cells and T cells and neutralizing antibodies that protect you from developing COVID. So that's been tested on around 23,000 people, and there were no side effects at all, not one serious side effect. Nobody needed hospitalizing. There are mild side effects like you would see with all other vaccines. And the efficacy for that vaccine was around 70% overall. But then there's a different dosing regime where the efficacy is 90%. So what that means, it would stop 90% of people who have the vaccine from developing coronavirus. The Pfizer vaccine is slightly different. It's what's called an mRNA vaccine, which is a small piece of genetic material that once injected, again, the cells of your body are tricked into thinking it's the coronavirus, and it's a spike protein, and therefore it triggers your immune system. Now, the mRNA code, again, that technique is not new. That's been used for many medications, cancer medicines, etc. And so, again, what both the Oxford and Pfizer vaccine teams have done is build on existing technologies. So the only piece that's new is identifying the genetic code for coronavirus and tweaking what the technology that they already have to produce the coronavirus vaccine. And that's why it was so quick. So if you think about the years and years and years of experience in building that technology, they just added this on top of that. They haven't built it from scratch since March. The second reason why they've developed it so quickly is all of the usual kind of administrative hurdles that there are for conducting research trials. They've been fast-tracked. So they haven't been bypassed, they've been fast-tracked. So the safety record hasn't been compromised at all. And the third reason is that for any vaccine trial like this, you can only go as fast as the people catch the infection, because that's the end point of knowing whether it's effective or not. Because we're in a pandemic, there are a lot of people, the rate of catching coronavirus is high, and so we've reached that disease endpoint much faster than in normal circumstances. So that's why it's a lot faster. What I really like to reassure people about is that despite pharma companies, and I understand that people are a little bit skeptical of pharma companies, but the work done by the pharma companies is independently reviewed by several other bodies who in no way would financially, commercially benefit from the vaccine. So for the Pfizer vaccine, which is the one that the government are going to use first in the UK, the data were reviewed by the Drug Monitoring Committee, which is a completely independent body. It was then monitored in the UK by the Commission for Human Medicine. So they looked at all the data again. The Joint Commission for Vaccines and Immunisation, who would normally roll out any vaccines in the UK, they looked at the data and developed a protocol for vaccination, i.e. who needs to be vaccinated. And then the Medicines and Healthcare Products Regulatory Agency in the UK, it's their job to approve and authorise any new medication vaccine, and they gave the approval. So I would completely trust all of those independent bodies, because they absolutely have no incentive to put forward something that isn't completely safe.
Okay, so that's so fascinating, and it's we never learn. So we talk about like the misinformation that goes through, and it'll bond with your DNA and all that kind of stuff, and all this stuff that gets put on social media that I never buy. But I think that because whenever you go through any sort of academic learning that involves reviewing of information, reviewing of sources, you very quickly learn about how to do that. You very quickly learn about how to sort of do away with things that you've not. Where was that resource from? You know, when you actually have to question that part of your academic studies, when an assignment actually involves you to check and remove poor sources of information, that actually you learn quickly that social media is just an absolute haven of misinformation, of lies, and of just like someone can just make anything they want, post on social media, and within 5 minutes it's been shared hundreds of thousands of times and becomes factual information. So thank you very much for that detailed and yet sort of simple to understand explanation. They've basically brought it out so fast because the technology and the research already is just putting those pieces together to produce something that is going to be effective. So thank you very much for that. So we're nearing on the half an hour. So what I would like to ask you is effectively, if you've got advice, and I know you're probably going to have a lot of advice for people, but what advice would you have now for the British public, for the people involved, and what could we do moving forward?
So my advice is to, exactly as you said, be selective where you read your information and what your sources are. And do not just take the information from somebody who has, I don't know, Googled the information, etc. So on Twitter, there are some people who I would say are very reliable. Tim Spector, Carol Sikora, Alison Pollock. These are professors who work in the area, and they have a very balanced view. I don't like, there's a lot of division in terms of schools of thought, attitudes. I think we really need to look at those who are balanced and are not taking any extreme views. Continue with the preventive measures, but really the key to getting this under control is the test and trace. So testing early, isolating. Please do isolate if you or somebody who lives with you has coronavirus, and really protecting those who are vulnerable.
Yeah.
And then finally, the vaccination. At the moment, it's people who are over 80, have serious chronic conditions, are frontline workers, or in care homes who will be first in line. So I'd really encourage to talk to your loved ones and get them to have the vaccine if they fall into any of those categories.
Yeah, that's really interesting. Thank you so much. And this has been absolutely fascinating. I can see there that someone's asked me to share on your page. Yeah, it is absolutely. It will be part of my IGTV, and it will go up in literally 2 minutes. What an absolutely fascinating TV.
So I had a lot of questions, which unfortunately I couldn't answer today.
Do you want to answer a couple right now? Should we extend it by 5 minutes and answer a couple now?
If that's okay with you, because I've had over 20 questions.
I wouldn't want to stop you. I think we've got a responsibility to extend it by 5 minutes if it's going to help people. So please answer the questions.
So one of the conspiracy theories is around the addition of, microchips, nanochip technology, mercury, aluminium, lots of other things. The list of what's in the vaccine is not yet available. It will be available on the MHRA website once the vaccine is available. So anyone who's worried to go onto that website. Some people, very few, are genuinely allergic to some types of vaccine which has egg in. So if you're worried about that, go and check the website. Everybody else, I wouldn't worry, because so many independent bodies have checked the safety that I do not have any concerns about safety. Which are the questions should we answer? Was this only tested on healthy individuals? Yes, largely it was, but they're now doing the testing on people with HIV, poor immune system. Hasn't been tested on pregnant women. Pregnant women won't be offered this vaccine at the moment. Hasn't been tested on kids. Kids won't be offered the vaccine at the moment. Which vaccine is better? They have very similar efficacy, which is and safety, which is mostly what we're concerned about. The Oxford one is a lot cheaper, so I guess the government would prefer that one. And logistically, it's easier to use. Is it possible for the vaccine to be harmful to long-term health? There's no, as I mentioned, this has been used, this technology has already been used. We don't envisage any new side effects, but there's a phase 4 study which is to continue monitoring the effect of the vaccine going forward. So that's also being studied. Okay, we should probably leave it there.
If there's any more you want to ask, you can answer them now. I'm finding the whole thing fascinating.
No,
The
I'll do
nanochip
that
one for
anyway.
me is the most tinfoil hat one. They're going to inject you with nanochips so they know where you are, what you're doing, what you're buying, what you're listening to. You are writing that on an iPhone. Like, they already know all that stuff. Like, that is ridiculous.
Yeah, I've heard that one, and the 5G masks and lots of other conspiracy theories. No, I really have no concern that there's nanochip technology in the vaccine.
Okay, awesome. Well, I then what I'll do is I shall. You heard it here first. Is that I will go and get the vaccine, and I'll do a video of me having the vaccine, and I'll put it out there of me getting the vaccine, and then I will make sure that I don't grow an elephant's tusk or a club foot or a third eyeball. And I'm sure that I'll be fine, and I'll use that to sort of promote it, because I think that our greatest chances of returning to normality are getting fit, getting healthy, and getting this vaccine. And there's small businesses, there's people's mental health, and there's a lot of things riding on people, like just getting on with life now, getting this vaccine in and pushing forward. So I really, really appreciate your time. You've been a really fantastic guest, very, very informative, and it is going to go up on my profile in literally as soon as I can upload it, the sooner it will be on there. That's what my plan is right now. So thank you so much for your time. I really appreciate it. And we'll have to go for a coffee because we only live down the road from each other. Well, I'm up in Birmingham at the moment, but I spend a lot of time still down your way. So we'll have to meet up for that coffee before, hopefully before the world just becomes mad busy again.
Don't say before the next lockdown, because we don't want that.
Couldn't manage another one. All right. Thank you so much.
Okay, James, speak to you soon.
Cheers. All right,
thank
bye-bye.
you. Thanks everyone for joining as well.
You're welcome. Thank you very much. Cheers, everybody.
Bye.
Bye.